Good morning, dear students. So today's chapter will be a continuation of the previous chapter, that is CBCT. Okay. Earlier we had learnt about the basics and the volume acquisition part, and today we will be doing the volume preparation part and a note on. So today's chapter will be and a little bit note on the interpretation part as well, so as to what it has to contain, how a report should look like, and task specific CBCT. Okay, so I'll be explaining each of this in detail. So what you have to learn about volume preparation is once we have positioned the patient, exposed according to the parameters, the exposure parameters, and you have a volume set or a volume data set which is ready. That is a part of your volume acquisition. So once the volume is accumulated and it is in the software, we have to prepare the volume, or it simply means that we have to put together many different planes of images so that we get a diagnostically valuable image. Okay, so now here we will be learning that what are the different stages in which the volume is prepared. Okay, what are the stages, what are the methods we will be learning. It is very simple to understand. I have included the photos as well, and you can always refer to this textbook, White and Farrow South Asian edition. Okay, this is a reference from that. It is more clearly given and the pictures are self-explanatory as well. Okay, so let us go into this chapter. Sorry. Yeah. So image visualization should also be by digital display, because right from the beginning we have put everything into digital or a software related image methodology. Okay, so the image preparation as well as the visualization, when you are seeing it, it should also be by digital display. So everything is computerized. So expanding the use of volumetric data for treatment planning and image guidance of operative and surgical procedures is facilitated by the use of appropriate application of software. Okay, see this one. Whenever we take a CBCT, there are three things to keep in mind. That is the orthogonal planes, or the different planes of the head in which the image can be reconstructed as well as viewed. Okay, and even in a single patient, or even for a particular single tooth, it can be viewed in three different planes. Okay, and the first image A, this shows the different planes color coded wise. Otherwise it is simply the coronal, sagittal, and your axial planes. Okay, these three are the planes in which you are going to see the images or the scan volumes. Okay, now, stages in volumetric data display. Okay, what are the stages in which you are getting? Once the data set is ready, you have individual multiple slices ready. How are you going to, after the reconstruction is also done? But it is not enough to view or to interpret the data. So, volumetric data display has to be done, which falls under 4 steps. First one is to reorient the data. Second is to optimize the data. Third one, view the data. Fourth one is formatting the data. Now we will see one by one what happens in each stage. Okay, so reorientation, what does it mean? You are being given something and you reorient it. Means according to your purpose, what you want to see, that adjustments are applied to that particular data, which is simply called as the reorientation. Okay, here the volumetric data set can be reoriented in all three planes using the software. Initial adjustments should include reorientation such that the patient's anatomic features are realigned symmetrically or according to a reference plane, that is coronal, axial, sagittal. This stage is particularly important for aligning subsequent cross-sectional transaxial images perpendicular to the structure of interest, such as to visualize single tooth pathology, to measure the maximal height and width of the residual alveolar ridge in an edentulous segment for implant site assessment, to compare TMJ condylar morphology, or to perform a craniofacial analysis. So anything has to be aligned or oriented to the particular plane based on what structure you want to see or what task you want to perform. Okay, that is called as reorientation of the data. See this image. Okay, here what it is. Here this thing on the right. Okay, there are images which are axial, coronal, sagittal images are there here. Okay, what is it? When you come to B, that is this one. Okay, in all this A, it is this way. In image B, if you can see all the other structures which are supposed to be in the anatomic part, that is the area of interest or what you call as the field of the view, it is all put together over here. Okay, it is reoriented. Okay, the circular rotational tool which is used over here, the colored circles in this, okay, they are superimposed on the images to be viewed, and then they are put together, and then you get the resultant image like this. Okay, and these are the planes which are drawn. Okay, the reference planes. So this simply means that a raw data is reoriented according to the region of interest. Fine. So this is the reorientation of the data. See here. In this also, if you can see, okay, reorientation of the sagittal plane to the occlusal plane. Okay, this is the reference plane in this one. Okay, here what happens, reformatted panoramic image, or you can call as, can you see this third image from both the top and the bottom line? You have many different lines over here which is there. Okay, this is the volumetric data, and then this line is drawn so that you can even image this in a panoramic format as well. Okay, so and this one, this is the relationship which we are drawing to show the relationship with the teeth and the maxillary sinus in many different views. Okay, the sagittal, this thing, what do you say, the coronal and the axial planes, and cross sectional images as well. Okay, so this is what it means, that we have to first establish the relationship of the structures with the reference plane, and then the area of or the region of interest, that is called as reorientation of the data. Okay, then we call as then the second stage comes, that is called optimizing of the data or optimize the data. To optimize image presentation and facilitate diagnosis, it is necessary to adjust contrast window and brightness level parameters to favor the bony structures. After the adjustments, secondary algorithms such as annotation, measurement, magnification can be applied with confidence. Okay, see this one, this is the first image which is coming. Okay, then you apply some amount of brightness or the contrast here, and this is the final image where you can actually appreciate many different structures because of the proper brightness level and the soft tissue contrast. So this is like optimizing an image so that it becomes easy to diagnose it. Okay, then third one, to view the data. Once you reorient and optimize the image, you have to view the data. Okay, what do you view the data? And I think many of us have seen how a CBCT data is viewed. You keep scrolling it, right, from the head section to this one, that is, it is called as craniocaudally. Okay, so what it means is, it is necessary to view each series dynamically by scrolling through the consecutive orthogonal image stack. This is referred to as sign or paging mode. Scrolling to be performed craniocaudally and then reverse, slowing down in areas of greater complexity, TMJ articulations and skull base. Scrolling to be done at least in the coronal and axial planes. Viewing orthogonal projections at this stage is recommended as an overall survey for disease and to establish the presence of any asymmetry. Okay, so next, the last one will be to format the data. So what happens in viewing of the data? You have the data which is reoriented, and you have even increased the or adjusted the contrast and the brightness, and then you are viewing it. What best can you see there is that what is normal, what is a pathology, and any asymmetry is there between the two sides of the midline. Okay, after that we format the data. What is a formatting? Formatting is something in which we have to look at certain things, okay, but we don't want to look at the other structures. For example, okay, in that case, to highlight only what is required or any specific diagnosis has to be performed, then we format the data wherein only that part of the image will be highlighted or will be more what do you say, it will be more useful, okay, so that, and it will be least confusing, so that the background structures also don't appear with that much of contrast in that. Okay, so that is the format of the data. So protocols incorporating FOV scan exposure parameters and display modes should be applied selectively to highlight anatomic features or functional characteristics within a specific diagnostic task. Three basic format options are multiplanar reformation, that is called as MPR, Raysum, and volumetric rendering. Okay, we must see what each of these are and how they look like. Okay, so see this one, you can just see in this diagram or a tabular or a flowchart like representation that what exactly we are doing. Okay, see here, coming to the left of the image, you have the axial, coronal, and sagittal section here. Okay, if it is a these are the orthogonal projections. Now MPR, okay, what happens in a multiplanar reformatting or reformation? What happens is you have different the image is divided into different planes like the linear oblique, curved oblique, and serial transaxial. Okay, what is the use of multiplanar reformation is whenever you want to see any particular structure in reference to the plane. Okay, these images are split up into the linear oblique angulation, curved oblique, and the serial transaxial. So where does this come into picture? And then there is a tool in which you draw the area to be visualized. Okay, then it can appear as a, if it is a curved oblique plane, it can appear as a panoramic. Okay, it is a simulated panoramic image, it can be appearing as that. In this, what can you see? You can see the edentulous arch with much more effectiveness, wherein you have to place an implant or something like that. Okay, whereas in a linear oblique you can establish the relationship between the condylar head and uh, the fossa. Okay, that is for TMJ calculations or analysis. Then serial transaxial is something which shows the cross sectional. These are useful even for one single tooth analysis, wherein we can see any of the endodontic or surgical related or any other thing, we can see it in this. Okay, this is the thing. Now coming to the first image, another thing which can happen from this is, it is called as the ray sum. What is ray sum? Whenever you are being given an image, you want to add thickness to it or dimension to it for a better visualization. See here, the first one is also a this curved oblique. This is also a simulated panoramic image, but does it really look like a OPG? No. So we add more thickness to this and the resultant image is this one over here. Okay, this we can appreciate better. Fine. The next one, orthogonal projections, the last one, volumetric rendering we call it. That is called as IVR, that is indirect volumetric rendering and direct volumetric rendering. They look like this. So we'll study in detail how it happens also. Okay. This was just to make you understand that what three possible format options are usually followed for a CBCT image. Okay. Next, multiplanar reformation, MPR. The volumetric data set can be sectioned non-orthogonally to provide non-axial 2D planar images referred to as the MPR. Okay, see over here, if this is an axial section. This A1, this is an axial section. I'm taking a tool and I'm drawing the reference planes over here. But what I want to see, I want to see the image in the form of a panoramic radiograph, like an OPG I want to visualize. So what am I doing? This thick white line is there. So I'm drawing it this way. Okay. And the resultant image. So I have actually split up the image like this. So resultant image, I'm getting it as a simulated panoramic image here and a cross transaxial image where you can see the alveolar bone and the tooth as well. So this is the one which we use for implant site assessments, right? So there MPR also plays a very important role. Okay, so multiplanar this thing reformation images are looking like this. Okay, this is one of the formats of a CBCT. Next, Raysum. The slice thickness of MPR images can be thickened by increasing the number of adjacent voxels included in the display. What is a voxel? It is a volume element, right? Then this creates an image slab that represents a specific volume of the patient, referred to as Raysum. This technique uses the entire volumetric data set, and interpretation is negatively affected by anatomic noise, the superimposition of multiple structures. See this one. Okay, what happens here? Um, this is a axial image. Okay, here we have the fat, bone, muscle, and air, and all that over here. But look at the image on the right. This is a Raysum. Okay, it's a formatted image. Addition of voxel gray values, and then you are able to see much more better contrast and everything. But what is the disadvantage? You can look at the image and find out. It is not clear. It has a blur. That means anatomic noise is there, and there are objects which are superimposing over each other. So diagnostically, maybe certain structures might be confusing as well. Okay, so that is the disadvantage of a Raysum format of the CBCT image formatting. Okay, see this one. In all the three planes, okay, in all the three images, the image noise is more. Here also, it seems that some structure is overlapping, or maybe like a double image is being formed. The same thing here, okay, and in this area as well, because usually in panoramic, they are more, they tend to overlap certain structures as well. So raise some images wherein we are actually adding the thickness to the, or actually adding the slice thickness or the volume to the already existing data, then such problems tend to occur. Okay, then third one is called the volumetric rendering. It allows visualization of volumetric data by selective display of voxels within a data set. Two specific techniques are used. One is indirect technique, second is direct technique. Let us come to indirect volume rendering. It is a complex process requiring selection of the intensity or density of the grayscale level of the voxels to be displayed within an entire data set. This is called as segmentation. Technically demanding and computationally difficult, it requires a specific software. It provides a volumetric surface reconstruction with depth, that is 3D. Two types of view are surface rendering and volumetric rendering. Optimal procedure for visualization and analysis of craniofacial conditions and determination of relationships of various anatomic features. For example, inferior alveolar canal relationship to the mandibular third molar roots. Okay, just a minute. Sorry. Okay, so this is the image, okay, and this is the reconstructed or the indirect volume rendering which is there. Okay, one particular thing, it gives a three-dimensional view as well. Okay, then coming as direct volume rendering, it is a much simpler process that involves selecting an arbitrary threshold of voxel intensities below or above which all gray values are eliminated, understand this, okay, we only are looking at the region of interest, okay, and the threshold of voxel intensities which is already present. Below the voxel and above the voxel value, all the gray values will be eliminated. So this is most common technique in this is called as the maximum intensity projection, or else MIP. Okay, so MIP visualization are, this is MIP, it's typed as MT. MIP visualizations are achieved by evaluating each voxel value along an imaginary projection ray from the observer's eyes within a particular volume of interest and representing only the highest value as the display value. Voxel intensities that are below an arbitrary threshold are eliminated. MIP images have great utility for demonstration of the location of impacted teeth, TMJ evaluation, identify the fractures, craniofacial analysis, surgical follow-up, assessment of cervical spine anomalies, soft tissue dystrophic calcifications. Okay, here um, look at diagram A. Okay, in this fat, muscle, bone, air, everything is there. So selection of only the highest voxel gray values for display. Can you see the small box-like structures in this? In certain things, it is the gray value is more, certain things it's less, and certain areas are bright. So only the brightest, that is the highest voxel grayscale values are taken for display. Okay, this box is a representational of this box only. Okay, here how is it reformatted here? In B image, if you can see, only one pixel represents the combined additive value of the highest voxel gray size values from all pixels. Okay, this way. This is a direct rendering. Instead of splitting up in indirect, in a direct rendering, only the highest voxel grays are displayed directly into the image. Okay, now these were how an image or a volume is prepared in a CBCT. Fine. Now, after having understood this, we can go to the essential elements of CBCT radiologic report. So, once you are done with the CBCT imaging, how do you prepare the report and what are the basic elements which has to be there in your report? It can be divided into 4 headings: patient information, scan information, radiologic findings, and radiologic impression. Okay, in patient, under patient information, patient name, unique identifier code, or also called as the OPD number, date of birth, referring practitioner's name, and rationale for the procedure has to be mentioned. In scan information, succession number, date of procedure, date of report generated, location of the facility, equipment used, scan parameters and images provided, and problems encountered during procedure means patient motion artifact or something that has to be mentioned. Then third heading, radiologic findings. You have to write the general findings, specific findings, and significant incidental findings. Then coming to radiologic impression, you have to give a definitive or differential diagnosis, correlation to patient clinical issues, comparison with previous images if available, and recommendation for a follow-up, or even to recommend any other imaging modality so that the diagnosis becomes more better. Okay, so these are the essential elements of a CBCT radiology report. Okay, then task specific applications means, okay, it is coming under 3 different headings. So task specific, the name itself tells you, you want to do a particular scanning only for an endodontic assessment, then you do that. Okay, it is for each department wise or else the specialty wise application of a CBCT. First one, under diagnosis and pre-operative assessment, you have the implant site assessment, endodontics, orthodontics and 3D cephalometry, mandibular third molar position, temporomandibular joint, and maxillofacial pathosis. Okay, so these 6 are the task specific uh, specialty in which CBCT application is required. Then treatment planning and virtual simulations also demand a CBCT, that is image fusion. When you have two separate images and you have to fuse it in a particular reference plane, you require a CBCT. Then you have image guided surgery systems and rapid prototyping as well. Okay, so these are the task specific applications. And as we move on to the anatomy and the diagnostic part, we shall learn that how this come into function in each of the mentioned 6 specialities here. Okay, so coming to the MCQs for the day. First question, the multiplanar reformation includes which two-dimensional images? Okay, answer is A, that is oblique and curved. Second question, which best defines anatomic noise? That is C, superimposition of multiple structures. Question number 3, which technique provides volumetric surface reconstruction with depth? That is D, indirect volume rendering. Fourth one, which volume rendering eliminates an arbitrary threshold of voxel intensities? That is A, direct. Documentation of an imaging examination includes an image report and a C, that is interpretive report. Okay, more MCQs. C. Sixth question, what are the stages in optimizing CBCT image display? Reorient the data, optimize the data, view the data, and format the data. Okay, and sorry, there has to be an option E here. Optimizing, what are the stages in optimizing? Okay, that is the B one only, that is optimize the data. Okay, so answer is B. Then seventh one, which stage is required to align subsequent images? Okay, answer will be D, that is called as reorientation of the data. Eighth question, which stage is required to adjust the volumetric data set? Okay, that is called as, in eighth question, the answer is again B, that is reorient the data. Then ninth one, CBCT image contrast and brightness are adjusted in which stage? The answer is C, that is optimize the data. Okay. 10th question, scrolling is a process in which stage? Is it reorientation, optimize, view, or format? The answer is C, that is while viewing data you have to scroll it. Okay. Then 11th, sign is a term used for, is it paging, stacking, scrolling, or formatting? The answer is A, that is paging. 12th question, what are the options of formatting? Okay, multiplanar reformation, Raysum, or volumetric rendering? D, all of the above. Answer is D, all of the above are options of formatting. 13th question, which of the reformations are included in MPR images? Linear oblique, curved planar, serial transaxial, all of the above. It is D, all of the above. 14th question, which type of image formatting is apt for examining the teeth and alveolar bone? Indirect volume rendering, direct volume rendering, Raysum, or the MPR? Answer is D, MPR. Okay. Then the 15th question, the superimposition of multiple structures in CBCT images is called as B, anatomic noise. 16th question, the techniques used in volume rendering are direct, indirect, both A and B, or D, none of the above? Answer is C, that is both A and B, that is direct and indirect are used. So option is C for question number 16. 17th question, maximum intensity projection is a technique of indirect volume rendering, Raysum, direct volume rendering, all of the above. Answer is C, direct volume rendering. Okay. Then coming to 18th question, MIP images have great utility for location of impacted teeth, TMJ evaluation, craniofacial analysis, or D, all of the above. 18th one, answer is D, all of the above. Then 19th, soft tissue dystrophic calcifications are best visualized in MIP, Raysum, indirect volume rendering, or direct volume rendering. It can be visualized best in um, it can be best possible rendered in a multiplanar reformation. Okay, that is an MIP image. So option is A only. Then you have the 20th question. What are the essential elements of CBCT reports? Patient information, scan information, radiologic findings, radiologic impression. And there has to be an option E here. It is all of the above. So please mention it as E. The correction, I will be updating it. Okay. So 21st question. In a task-specific application of CBCT, why mandibular imaging or mandibular third molar imaging is done? A, to study relationship of the inferior alveolar nerve canal, to locate the third molars, to study canal anatomy, or D, both A and B. The option is D for 21st question. Both A and B are used. Okay. Then coming to 22nd question. In implant assessment, CBCT provides information on A, alveolar bone width, B, alveolar bone height, C, angulation, D, all of the above. The answer is D, all of the above. Then 23rd, CBCT imaging can depict what changes in the TMJ? A, degenerative disease, B, developmental anomalies of condyle, C, rheumatoid arthritis, D, all of the above. Answer is again D, that is all of the above can be, the CPCT can depict the all the three changes in the TMJ. 24th question. CBCT is not suitable for hard tissues, soft tissues, both A and B, none of the above. The option is B. Okay, soft tissue contrast is poor in a CBCT. So 24th question option will be B. 25th question. Image fusion is integration of two imaging data sets, reading of each data set individually, both A and B, or none of the above. That is image fusion is A. Okay, 25th option is A. That is integration of two imaging data sets. All right. So this completes the MCQs for the chapter CBCT volume preparation. Okay. So it's a missed slide here. Okay, so thank you so much. Our next topic will be anatomy in CBCT. We will be studying a lot more in a picture format only. Okay, so as to in all the three planes, that is sagittal, axial, and coronal planes, what are all the anatomic structures which are visible? Only if you learn that, you will be able to know what are the pathologic changes or any asymmetry is present. Okay, it will be a very interesting chapter as well, so it will be notified to you. Okay, all the best. Thank you so much.